Hello, my name is Reman Jabar, and I'm from Higher Education Consortium of Metropolitan St. Louis, Trio Educational Opportunity Centers. Today, we are hopefully, this is not going to be our last segment, but so far, this is our third part of the three-part series that we had on mental illness. And this session is anxiety and stress. And again, I have Dr. Frazier with me. Hi, Dr. Frazier. How are you?
I'm well. How are you?
Great.
Good.
I'm excited to talk about the subject. Something interesting, but I'll start us off here with I have a quote, and it says, "Mental illness is nothing to be ashamed of, but stigma and bias shame us all." And this is by Bill Clinton. This
Nice.
actually stood out to me, especially with what's going on nowadays in social media and in the world in general. This other picture right here is very interesting. When I looked at it, it was very interesting because this is exactly how I feel when I go through my little anxiety and stress situation. I love these cartoons because they really define me. So this is let's just say it's me, and then my brain is talking to me. So we'll just say, "Hey, you asleep?" And then no, I'm not. Obviously, sleep issues. I was just thinking of that terrible song from earlier. That happens all the time to me. Do you want me to sing it to you? And I'm like, no, I'm going to sing it to you. So you has that, look like, brain, I need you to shut down. So this one is actually very funny. It says, "Wake up. There's a problem that I need to solve at 3 a.m. for some reason. There is no easy way to say this, but long-term lack of sleep can cause a variety of health problems, even brain damage. You woke me up to say this." And then this last picture right here, bad brain. "No more anxiety. You're a bad brain. Your negativity is about to make me my anxiety is making me." It's hilarious.
Your negativity about my anxiety is making me anxious. Oh my
Yes.
goodness.
Yeah. That's me all the time. We're having a little issue there again. All right, Dr. Frazier. Here's the fun part. Questions. Me and my loaded questions. What is anxiety, and how is it different than stress?
So anxiety, in short, is an emotion it's characterized by feelings of tension, worry thoughts, and oftentimes physical changes, like increased blood pressure, increased heart rate, things like that. When you talk about the difference between anxiety and stress, it's a fine line because both are emotional responses, but stress typically is caused by an external trigger. So that trigger can be, for example, a work deadline or a financial struggle, an illness or relationship trouble, where anxiety is more defined by persistent or excessive worries that don't go away, even in the absence of a stressor, right? So there could be nothing really happening to pinpoint, nothing externally going on, but still the anxiety persists.
Okay. So, honestly, the best way I can explain it, and sometimes even like with my doctor or my boss loves me saying this, I freak myself out. And this is when my anxiety comes in. It can be nothing, like you said. I could just be sitting here doing my work. I'm on top of things, and I'm just me in my head, me and my brain are freaking ourselves out for no reason. And that intent for me to cause stress because I'm stressing myself out by giving myself
Mhm.
anxiety. You know what I
Mhm.
mean?
Mhm.
And it's I don't know how to explain it, but it's a challenge. You know what I mean? Especially
Mhm.
going through
Mhm.
that, it's
Mhm.
can't control it.
Mhm.
What causes anxiety? Because what is the causes for anxiety?
Yeah, so causes is always one of those things that researchers are always looking into and trying to pinpoint. But I'll say in general, there are certain risk factors for anxiety. One that we talked about with depression is genetics.
Hmm.
Your family, that can be a risk factor. Brain chemistry, environmental stress, um, stressful events at work, like what we were talking about, and also traumatic events that happen to people in their childhood or even in their adulthood.
Right,
Um, Another one can be, substance abuse, and certain medical conditions
right.
um, can play a role in anxiety as well.
All right. So, what are the symptoms of anxiety? And I made a list of things.
Yes. Yes, it goes on and on. I mean, your list and my list are looking very similar. Um, you know, the s- the cold, sweaty numbness, the shortness of breath, the trembling, increased heart rate, sometimes just, fear, tense muscles, what else? Heart palpitations. Yeah, sleep disturbance is a big one.
Hmm.
Difficulty controlling worry. Yeah, all of those things that you have. Your list is actually a little longer than mine.
Yeah.
Hmm.
Well, believe it or not, I believe that I don't know if you're going to believe me or not. I have and still have experienced
Hmm.
all of these symptoms.
I believe you.
Feeling nervous, even though I don't have nothing to be nervous about.
Hmm.
Yes, restless and tense. I'm always tense, and I'm very
Hmm.
jumpy.
Mhm. Mhm.
Like especially if I hear something unexpected, I feel
Mhm.
like my heart literally I jump physically, and
Mhm.
then inside is just like my heart start racing.
Mhm.
Um, and sweating, that's to me that's a normal thing which I've never had before, but started
Mhm.
having. A big one for me is actually fear or fear of losing control or actually losing
Okay.
control.
Mhm.
Um, really scares me. And then it gives me more anxiety and it
Mhm.
stresses me out. Um, sleep issues for me is definitely another big one.
Mhm. As we saw in the cartoon.
Exactly.
Mhm.
It's just like
Yeah.
you just can't shut your brain
Mhm.
off. Even if you want to, you just can't.
Mhm.
Um, I actually never, there's a few people that I've talked to that had this where they're experiencing GI problems. I
Mhm.
myself, um, how do they say it? Like I ball everything in where
Mhm.
my stomach, and it makes me sick to my stomach where,
Mhm.
nausea or vomiting happens.
Mhm.
It's not a good feeling at all.
Mhm. Mhm.
Um, So let's get this is very interesting for me because I didn't even know what anxiety is, but I'm pretty sure people are curious about this. I know I was at one point. Are there different types of anxiety disorders?
So there are many types. When I say many, I don't mean endless, but there are more than five. I can say that, and I'm basing that on the DSM, which is used to diagnose. And there are different types, and they all have different symptoms.
Oh,
But there, maybe I'll just say three that are pretty common: social anxiety disorder, panic disorder, and the one that I see the most is generalized anxiety disorder. So those are, some of the more common ones, but there are more. I mean, you could probably find them. Well, I don't want to say with a simple Google because sometimes they list ones
right.
that are not
Right, right.
actual disorders, but I would
Agreed.
say those are, three of the more common ones, but there are differences. And
Okay,
it's interesting because they all come with different symptoms.
agreed.
Mhm.
So what is an anxiety attack? Are anxiety attack and panic attacks different things?
So the thing about anxiety attack, it's not an official clinical term.
Okay.
It's more of something that has been coined by, people, people who experience, the type of discomfort that can come with anxiety, but it's not, an official term.
Okay.
So, based on how y- people, I'll say, um, people who experience anxiety along with therapists and counselors, people, they've come up with definitions. And one that I thought was interesting is that it really talks about an intense or extended period of anxiety. And I think what they were trying to say is people who experience anxiety, just like the things you described, there comes a place where it's so intense and it is for this extended amount of time that it is like an attack. It's more than just feeling anxiety. And so I think from what I read is how it was coined as an anxiety attack, because it's almost like, you're not managing the anxiety. It is pretty much overtaking you in that moment. Um, so that's how I would describe it. Not having a clinical definition, but that's what I would describe it as.
So I actually have a question then when
Hmm.
it comes to that. And maybe this is exactly what I was experiencing. Um it's uh it's actually very scary to talk about, but I would say about 2 years ago with me,
Hmm.
I was working at a hospital at the time, and this
Hmm.
was not here in St. Louis, it was in a different state 2 years ago. And I went into work, I worked evening hours, and what I used to do is actually I used to transport and
Hmm.
within the hospital. And it was like just a normal day. I can tell you this because I'm pretty sure you're going to ask me this question. I was dealing with a lot of stress at the time,
Hmm.
but when I walk into a hospital or any type of employment, I try to keep it professional. Whatever I'm dealing with outside
Hmm.
of my professional life, I try to keep it out. But sometimes you just can't.
Hmm.
You don't behave or act like it, but it's there. Obviously it's lingering, it's bothering
Hmm.
you. So I remember it was around 5 in the evening. I started work at 4, and I was on like a 15-minute break. I ran to the bathroom, and when I tell you, I washed my hands and I was ready to get
Hmm.
out of the bathroom, and I started having, and I'm gonna describe my symptoms because it literally scared me. I felt like I was having a heart attack,
Hmm.
where um my vision was very blurry,
Hmm.
and my main focus was a ceiling. And I don't
Okay.
know why. It was not something that it was just light, and that was my main focus. And
Hmm.
I felt like I just couldn't keep my head down. It was like
Hmm.
constantly up looking at the ceiling.
Hmm.
And I think that was the only time I've had a out of body experience
Hmm.
where I feel like physically I'm there,
Hmm.
but at the same time numb, and I could not get myself to get out that door. And everything in my brain was like fast forwarded. Like I
Hmm.
just hear I wasn't hearing things. I hear what's around me. And I heard
Hmm.
the door knock a couple times. What we had is we had like iPads where they page us if we have a certain patient we need to pick up.
Hmm.
And I get messages, and I'm seeing my boss sending me messages. Hey, you haven't picked up a job, and it's been like an hour or so.
Hmm.
And I was stuck for the bathroom for 2 hours, and physically I could not get myself out of it. And I was sweating. I felt like I was breathing hard.
Hmm.
Um, my body, I just felt like my neck was hurting, but I just could not get my head down. Would that
Wow.
be a panic attack? Because it
Wow.
never happened to me before. That was the first time.
Some of those sound familiar. Some of those I can't say. I'm not sure. Because I will say a panic attack. One of a lot of the similarities. There are a lot of similarities between what you said and what a panic attack is,
Right,
because it's a pretty abrupt onset
right,
of like intense fear or discomfort,
right,
and it reaches like a certain peak within minutes.
right.
Right?
It,
It doesn't like build. It's just like you're
it
there.
comes on, it came out of
Hmm.
nowhere. It came out of
Yeah.
nowhere, unexpected. And it's
Hmm.
just like you couldn't do nothing but literally let it pass. And how
Hmm.
long it takes, honestly,
Yeah.
I don't know how long it took for
Yeah,
me.
and that's the part I'm not sure of the time. When you're because a panic attack, as described in the DSM, for it to be a panic attack, it has to have at least four. There's a list of symptoms, and it has to have at least four to qualify as a
Right,
panic attack.
right,
And some of those you describe, like the sweating.
right,
One of them is, kind of a feeling dizzy, unsteady, lightheaded. There's another one that kind of sounded like, yes, this is the one that really made me say, wow, is derealization, feelings of unreality, or depersonalization, which
right,
is being detached from oneself.
right,
And
right.
so when you talked about like that out of body experience,
Yeah,
it resonated with that. Um, and some other ones are like fear of dying, fear of losing control,
yeah.
chest pains,
Hmm.
feelings of choking.
Oh
Yeah.
yeah,
So
oh yeah.
yeah. Yeah. So.
Honestly, um, I mean, I don't like to think about it or try to
Mhm.
remember. Like I said, it happened 2 years ago, but it really scared me.
Mhm.
And
Mhm.
I did actually talk to my doctor,
Mhm.
my psychologist, and
Mhm.
I pretty much described it, but it wasn't at the time that it happened. It was like maybe year and a half ago after, because
Okay.
I get like I'm afraid that it'll happen again. And
Mhm.
I do remember I got to a point where I like literally wanted to break down and scream, but I'm in the middle of a hospital, so I
Mhm.
couldn't do that. I
Mhm.
remember going to my
Mhm.
boss because it was like all the way in the basement, and I was telling him, look, I don't know what's going on with me. I know I don't
Mhm.
feel normal. I can't
Mhm.
explain to you what's going on with me, but I don't think it's safe for me to be here. And I mean, obviously, the safest thing for you to be is in the hospital. But if you can't explain what's going on with you,
But
and
not as an employee.
exactly not as an employee,
Yeah.
and I
Mhm.
just felt like I'm not gonna jeopardize. I don't know what was
Mhm.
going on with me.
Mhm.
You never know. Not that I
Mhm.
behave in a physical way, but I remember I was very scared to get in my vehicle and drive
Mhm. Mhm.
because I was frozen.
Mhm.
And
Mm.
I remember sitting in my car for 3 hours after I told my
Wow.
boss I need to go home. And I sat for 3 hours because I was like, I'm not getting on the road. I don't
Mm.
want to harm anybody. And I don't know what's going on with me. And yes, I'm a lot of people, like I remember my sister asking me, well, you were in a hospital. Why you didn't go tell them, hey, this is what's going on with me, get help? I said, how do you expect me to explain something
Mhm.
when I don't understand what's going on with me? You know what I
Mhm.
mean? I
Mhm.
have to, like, I don't know, go through it, go through the emotions and understand
Mhm.
first before I can explain. And I was
Mhm.
scared. I was scared to death.
Yeah.
So I don't know
And
if
and
it
that
was
can keep you from going to talk to someone too, because
exactly,
you don't know how
exactly.
they're going to respond, what they're going to do to you. There's nobody there with you.
I was
Um,
paranoid. I was very
mhm.
paranoid. Yeah,
Mhm.
yeah.
Wow.
So here, can anxiety escalate into a panic attack?
So the thing about a panic attack, as we just discussed, it's not necessarily an escalation of something.
Right,
What panic attacks, they can occur in the context of any anxiety disorder,
Right.
as well as depressive disorders or post-traumatic stress disorders. So it's something that can happen in the context of that disorder. So it's not necessarily, an escalation. You could arguably say, well, if a person has anxiety, they can't have panic attacks. But it's not necessarily a straight line,
Right.
right?
Right.
It can
Right.
just be like what we described.
Yeah.
The onset of it is just intense, sudden, abrupt. So, you know, you could say maybe. There obviously are connections, but
Yeah.
it doesn't mean that because someone is really anxious that they're going to have a panic attack by definition. They
Right.
may experience more of the anxiety attack, like we talked about, where
Right.
it's so intense, it's so overpowering. Those symptoms are, but it just doesn't fit the definition of a
Right.
panic attack. Not that it's, not as intense or not as serious, because it is to the person who's experiencing it.
Right.
Um, but
I mean,
yeah.
I would have to agree, especially when I have experience
Mhm,
both of these things. And anxiety,
mhm,
actually, it's like I hate to admit this, but it's everyday thing for me, whether it's
mhm,
high or low. Some days are
mhm,
really low, some days are very high. I think it just depends on what you're doing and what's the load and stuff like that. But anxiety, I'll tell you this, I'm not a medical doctor, nor am I a psychiatrist or a therapist, such as yourself. But they're two different things. What I've
mhm,
experienced personally,
mhm,
me
mhm,
personally, they're
mhm,
way too different. Like they're very
mhm,
different.
mhm.
And I have experienced both of
Yeah,
them.
and your experience counts. I mean,
Yes. Yeah.
a lot of times medical professionals, behavioral health, whatever field you're in, we're looking at it from a vantage point of information and things
Right.
that people tell us and what we understand.
Right.
But a person experiencing it, I
It's
mean,
very real.
it's
It's
very
very
real
real.
and it's very valid. Yeah.
Right. Right.
Mhm.
But like I said, I don't know if it's safe for me to say this, but panic attacks, like I said, I don't know what causes them. I can only, I don't know, guess and say it just depends on the load of stress, load of anxiety that you're going through. Are you dealing with the issues that you're going through and the emotions that you're going through? In my case, I'm gonna say no. I'll be the first to admit it. I was, how do they
Mhm.
say, sweeping everything under the rug
Mhm.
and not dealing with it, because who wants to deal with pain, right?
Right. Mhm.
And so far, I would say the only time that I can recall was 2 years ago when I had this panic attack one time,
Mhm.
and let's hope
Yeah.
not anymore,
Yeah, I hope
because
you never have it. Yeah,
that's
have it
that I
anymore.
that's something scary that I've experienced. Really
Mhm.
scary.
Mhm.
Okay, can stress or certain medication trigger an anxiety or panic attack?
So I'll speak to the medication part because the stress kind of goes with the anxiety part. Um, the thing about medications that's it's really interesting. It's a really good question. And, I'm not an expert on, all medications and the specific side effects that they have, but we know if you did nothing but watch commercials, we
Right.
know that medications have potential side effects. I
Yes,
mean,
they
you
do.
watch these commercials and then the person starts talking really fast about all these side effects. So we do know that
Right.
medications come with potential side effects. So, I would say that I'm sure there are medications that we take every day, over the
Yes.
counter, prescribed, that can contribute to stress or anxiety. Um, that can then possibly link to some type of anxiety attack. So there's probably some linkage and some connection.
Right.
Exactly how that goes, I can't speak to it. But what I
Right.
would say is, I suggest that people, when you are given medication, whatever kind, or if you're just taking something over the counter, that you do pay attention to the side effects.
Agreed.
If you do, particularly, from the pharmacy, because they have them nicely printed out there,
Right. They do.
that you read them. And if you
Right.
are concerned, that you do talk to the prescribing medical professional and not just, ignore them. Because sometimes, particularly if you're already dealing with anxiety or dealing with stress or dealing with depression, and you're reading that this can potentially have that side effect, you just want to talk that through
Right.
with the person who's prescribing it.
Yeah. 100% agree with you. Actually, that is the first question I always ask my doctor, whether it's
Mm-hmm.
my medical doctor or
Mm-hmm.
I always say, what is the side effects? And I don't know if you can call me a little control freak, but I actually have this little notebook with all the medication that I take and all the side
Mm-hmm.
effects. But believe it or not, every person obviously is different when it comes to medication,
Mm-hmm.
how your
Mm-hmm.
body reacts to it. My body hates me. It reacts to every side effect that they print on that little label that they give you or tell you about.
Mm-hmm.
I get it. And
Okay.
it's very scary. So yes, please check your medication, ask the side effects.
Mm-hmm.
There's always options. I mean, I don't know if you guys remember me saying this. Yes, you do have to be a guinea pig until you find the correct medication. So,
Mm-hmm.
and that includes side effects.
Mm-hmm.
So I
Yeah.
agree. Yep.
Yeah.
What does stress do to your body?
Um, Interesting question. So the thing about stress is it can depend, right? So if you're stressed for like a short period of time, like I have some deadlines that are looming.
Right. You're
Actually,
stressed
one I
out.
just realized that is due in 2 days that I completely
Okay.
forgot about.
It
Exactly.
happens.
So
Yes.
this is a short-term period of stress because I completely forgot about it. So some physical, signs of, what it can do to your body. So you may have headache,
Yep.
fatigue, or
Mhm.
may have difficulty sleeping because I'm laying there thinking, how am I going to get this done, right?
Yes.
Difficulty concentrating because I'm thinking, oh my goodness, I only have 2 days. How I'm going to get this done, right?
Right. Right.
So those kind of things, upset stomach, being a little irritable because I'm annoyed because I forgot that this is coming up,
Yes.
right? So
Yes.
those are like short-term stresses. These are things that we can normally manage. Just go to sleep, just take a Tylenol, or we can normally manage those kind of short term stressors and what it does to us physically.
Right.
But when it becomes a long term, it's not properly addressed, it can lead to some more serious health conditions, where we're talking about, high blood pressure, heart disease, like the heartburn, the ulcers, um, even like depression, you
Right.
know, flare up in asthma, weight
Mhm.
gain, weight loss,
Yes.
so it can start to, affect, even acne, people can start breaking out, and, it can affect people's fertility and,
Yep.
sex drive. And,
Mhm.
so it can really, upset our stomachs, constipation, diarrhea. It can really kind of wreak havoc physically in a person's body. So, which is why, stress is common, right? Everybody feels stress at some point. So it in itself is not bad. It's what do you do with it? How long
Right.
does it last? How do you manage it? So, if it's not being dealt with, if it's not being managed, and you kind of get into that long term um effect, these are some of the things you can see.
You know, if you, what Dr. Fraser is trying to say is don't do a Reman Jabar. Do not sweep it under the rug. And, um, and let me tell you, again, I hate to admit this. I hate talking about it, but I am going to talk about it because, again, I'm a witness and I'm a person that went through this. And
Hmm.
when I tell you, when you neglect, like you're not eating, you're not sleeping,
Hmm.
you're just constantly on the go and go
Hmm.
and go and go. I lost weight. I The smallest I ever been was 112 pounds.
Okay.
And that is not a pretty picture. You do not, I'll show you the picture one day, Dr. Frazier.
Okay.
And I don't recognize myself. That's
Mhm.
like literally stress will do that to you. And
Mhm.
I felt like it was eating at me every single day. And
Mhm.
sleeping, I still have sleeping problems to this day
Mhm.
because I never dealt with it in the beginning. It was
Mhm.
sweeping that under the rug. I, I'm on a mission. I get things done. And it's just like,
Mhm.
you need to like stop,
Mhm.
breathe. Stress and problems don't run away.
Yeah.
They'll be there tomorrow.
Mhm.
Um,
One thing I want to say too about stress that's it's very it can be a little on the sneaky side.
yes.
So when I was 19, which was a very long time ago, I went to the doctor because I could not breathe properly. I just had this difficulty catching my breath and I couldn't get a really deep breath.
Mhm.
And it, back then I won't say stress wasn't like really heard of. I mean, I'm not that old, but
Yeah.
it was sort of a newer phenomenon where
Right.
I'll say new in the sense that where they were starting to link it to physical effects,
Right.
right?
Hmm.
And so the doctor, he told me, he said he called it stress induced asthma. And I
Wow.
was looking at him like, I don't understand. He said, okay, you don't have asthma,
Okay.
but your body is responding like it has asthma. So you have to use this inhaler.
Wow.
And I had an inhaler for a period of time. I can't even tell you what I was stressed out about. But he says, so if you have difficulty breathing, you have to use this because your body, in essence, doesn't know it doesn't have asthma. And so it's kind of playing out
Mhm.
this ailment, even though you don't really have it. Like,
It tricks your brain pretty much.
yes.
Yeah.
And so I had to use the inhaler, just like someone who had asthma, until whatever the stressor was, which again, I don't remember, but I
Right.
do remember it no longer being there and I never used that inhaler again.
Yeah. Yeah.
So, yeah.
Agreed.
Mhm.
My body, like you said, it does sneak up on you. My
Mhm.
body, I have no idea why my brain said it was a good idea. I think the longest I went without sleep for 5 days.
Mm,
And
mm,
I don't know, my brain just kept telling me, no, no,
mhm,
keep going, keep going, keep going.
mhm,
And then you crash,
mhm, mhm,
and then it's so hard to pick yourself up when you
mhm,
crash. I mean, not sleeping for 24, 48 hours does a lot of damage. Imagine 5 days. So,
mhm,
oh,
mhm.
trust, I know, I know.
Yeah, yeah.
Okay, how can I tell if I had a normal anxiety or like normal anxiety or an anxiety disorder?
Um, Good question. All your questions are always so thought provoking.
I'm so sorry.
No, no, nothing to be apologetic about. So, normal anxiety, like we said, even
Yeah,
like stress,
yeah.
anxiety, we all feel it. We sometimes feel nervous, we sometimes feel worried and things like that. But I would say, when it's the acceptable, you can kind of manage anxiety. A lot of times it'll be related to a specific situation or problem.
Okay.
Once that is kind of over, you kind of resume back to, you know, your status quo. Um, it's proportional to the situation, right? So what I mean by that is, you know, you're feeling anxious about doing a speech in front of, 5 people. That can be anxiety provoking, right? Because you're
Okay.
standing in front of
Yeah.
people.
Hmm.
So you may have butterflies, you may be nervous. And it's like, okay, this is, that's proportional. I'm going to be
Right.
standing in front of people. I'm
Right.
wondering, what does my hair look like? These things that we kind of have going on in our minds, of what are people going to think about me? Things like that. That's within the range of, I'm just kind of anxious because I got to stand in front of people.
So,
Mhm.
Dr. Frazier, if you don't mind me ask, okay, so like this is the best way I can describe normal anxiety, and then you tell me what you think. You know how like if you have a test
Mhm.
and you studied for it, and but you freak yourself out, and
Mm-hmm.
you're about to go in and take a test.
Mm-hmm.
And during the test, you freaking yourself out, and you know everything, but you start forgetting everything because it's anxiety kicking in. It's the
Mm-hmm.
butterflies, is you feeling sick to
Mm-hmm.
your stomach. But then when the test is over, you're normal.
Mm-hmm.
So
Yep.
that's
That's it.
that's it.
Yeah. Yeah.
Um, and then I'll let you explain anxiety disorder.
Yeah. So when someone has an anxiety disorder, sometimes you may have anxiety. It may come up for, like we said earlier, seemingly for no reason.
Mhm.
The anxiety response to the situation may be much stronger than what you would expect. Right. So you have a test, but you are like hyperventilating. You cannot breathe. You cannot catch your breath. You feel like you're lightheaded, dizzy. It's a little more than just the butterflies or the did I study enough sort of thing.
Mhm.
Um, it may last for a long time, even when the situation is resolved and it's over. You're still having these symptoms. It doesn't leave, like you said, the test is over, you breathe, you're like, okay, next. People who have a disorder, they may still experience certain symptoms. And the anxiety feels impossible to control or manage. It feels like you just cannot get it to stop. You have no control over it. So those are things when those things are happening. You may wonder. One more is sometimes people who are dealing with an anxiety disorder, they'll avoid like situations or things, um, because they don't want to be triggered. It's much more of a much more fear about certain things, like, okay, I don't want to go there, I don't want to be here because that may, and so it can lead to, it can really affect your well life, I'll say it that way.
So it's funny that you say that, because this reminds me back. I want to say 6 months ago.
Hmm.
Um, there's a lot of things that I avoid talking about, or there's like certain names that is not allowed to be said around me. Let's just say,
Hmm.
and my
Hmm.
family is very aware of it.
Hmm.
And like you said, it could be anything to trigger it, and
Hmm.
then it could last a very long time. So that happened to me where it was triggered,
Hmm.
and it was around like 2 a.m. It was like 2 a.m. where I'm not sleeping because I already have
Hmm.
anxiety. And then
Hmm.
you put something on top of it where it's triggering it.
Hmm.
I like you exactly how you described it. I felt like I could not breathe.
Hmm.
And at the time, I wasn't living in the safest neighborhood. And,
Okay.
me getting out at 2 a.m. was not a good idea. But I
Hmm.
just felt like
Hmm.
I had to open the door and get out of my house because I could not breathe.
Mm.
I cannot catch my breath. Like
Hmm.
my my nose, like I feel it. There's air coming in and out, but it's just like it would not go past for me to breathe and like
Okay.
inhale and exhale. Do you know what I mean?
Wow.
And
Yes. Yes.
I remember going outside and actually catching my breath,
Hmm.
and then I was very nauseated and I started throwing
Mm.
up. And then it's just like, are you guys serious? Like
Hmm.
you just did this to me.
Hmm.
So
Hmm.
and then like you said, it does last. It actually lasted, I believe, all night where I did not
Hmm.
sleep.
Hmm.
So yeah, normal anxiety and having an anxiety disorder are very different.
Hmm. Two
Very
different
different.
things.
Yeah,
Yeah.
yeah. Um, what are effective treatment options for anxiety disorders?
This one is, it's pretty, I'll say, cut and dry.
Mhm.
Um, Medication is a big part of treatment. Everyone doesn't take it. It's not mandatory, but it is a big part, because it can, even if it doesn't make it go away, it can make it manageable. I have clients who take anti-anxiety medication just as they need it. Like they know they're going to take a test, right? They know they're going to be standing in front of people speaking. And so in order to just manage and breathe and do different things that they've been taught, just so those things can work, they take the medication. Other people take it regularly, just like, blood pressure medication or anything else. So medication is one. And then psychotherapy or counseling, that's those two are typically the tracks that you go down. Because even with medication, some people look for more natural things, but it's still a medication. With the psychotherapy and the counseling, in that you're gonna talk about different things. You're gonna talk about lifestyle changes that you can make to help. You're gonna talk about getting enough sleep, maybe changing your diet, and avoiding certain caffeine, too much caffeine, or working out. So the lifestyle changes, it's a part of it, but a lot of that you will talk about and learn about in therapy. And some people who don't go to therapy, they'll just make these lifestyle changes,
Right.
to try and help, treat some of the nervousness, some of the inability to focus, by meditating, sort of bringing your mind into focus. So but the two tracks that I typically look at are the therapy and the medication.
Right.
Yeah.
I agree with you on that one. I'm actually exactly the same. I do take medication for anxiety, but talking does help a whole
Mhm.
lot. And actually, just having those two and combining it together
Mhm.
makes it easier, I would say, to
Mhm.
manage it on your own when you need to
Mhm.
manage it on your own.
Yes.
Yeah,
Yes.
yeah,
Yeah.
I agree.
Yeah. Yeah.
What are the best ways to cope with anxiety and stress?
So, in addition to what we just said,
Yeah,
I'll say again, some of them overlap. Physical exercise. Physical exercise can be a big stress reliever, and it doesn't have to just running or jumping and hurting your joints,
right,
or your knees.
right.
Doesn't have
And
to
pay
be that.
for
It can
it.
just be walking. You said what?
I say, and then don't pay for it later. You're gonna have to pay for it later,
E-
especially when.
Exactly.
Yeah, yeah,
Yeah. It can just be walking
right.
calmly,
Yes,
but just moving the body.
yes,
Meditation, as I said, deep breathing exercises are good.
yes,
Prayer for people who pray. Journaling can help some people.
co-
Aromatherapy can help some people too.
yes, yes.
And there are a lot of apps that they have out now. I, recommend them to some of my clients to use, where you can do some of the journaling. Um, and it just has other things about meditation and breathing and just other little tips that you can find. But those are things that you can just sort of do on your own and should be doing. And even if you don't have an anxiety disorder, just to manage the everyday life. Sometimes just driving down the street and there's traffic, or just work, school, you got all this school work to do. Sometimes it's good to just know some deep breathing exercises, just to kind of calm yourself down and just take some of the pressure off in those moments. So any of those things can help.
Yeah. I there's a word that I would put when I say anxiety and stress, like mixing it together. You
Hmm.
know how like you have a blender and then you start
Hmm.
putting like all type of fruits in there, making a smoothie or whatever.
Hmm.
Literally, that's how my brain feels. It's just like you hear. I wouldn't say I hear voices. I don't hear voices, but
Okay.
it's just like, you know how you fast forward something or like you blend something and you go to high speed. My
Hmm.
brain feels like that because it's school and then it's work and then it's home life, and it's just
Hmm.
like the problems, or I have to do this and I have to do that, and it's just like you just want that to stop for a
Hmm.
second and breathe. So
Hmm.
yes, breathing, yes. I don't really, me personally, but writing, yes. I did try it, but I'm the
Hmm.
person that I don't really like to write things down
Hmm.
because I can express it better when I'm talking.
Yes. Yes. Yeah.
Like
Hmm.
I like to talk about it because I can express it or explain it better.
Hmm.
But what I actually did find out, which is weird at the time, but it's not to me anymore. I love coloring. Color,
Yes, that's a good one. Mhm,
coloring really calms
mhm.
me down.
Yep.
Um,
Mm-hmm.
I'm already like hyperactive, bouncing off the walls, but like
Mm-hmm.
mix anxiety with it.
Mm-hmm.
Give me something very interesting to look at and I can color, it literally goes down.
Mm-hmm.
And it's
That's
just
a
like,
very good one.
yes. So coloring to
Mm-hmm.
me, so like
I'm glad you mentioned that. Yeah.
like I remember my past birthday, or I believe it was Christmas as well. I always tell them I don't want anything else. I love coloring. So good birthday presents or anything like that, adult coloring books, they say. And then
Mm-hmm.
they're really, to me, they help a lot. I love coloring. There's also coloring
Mm-hmm.
apps as well. So
Yes,
I
I was thinking
recommend,
that. Mm-hmm.
yeah, I recommend that.
Mm-hmm.
That
Mm-hmm.
helps me. Um, okay, so in your opinion, when is the right time to seek professional help?
So I would say, um, like I said earlier, everyone experiences stress and anxiety to some degree. So
Right,
let's normalize it, right? I
right,
mean, it's a part of life. But when it starts to, let's say, interfere with your personal or professional relationships, it creates a persistent sleep issue. There may be some nights where it's hard to sleep, but if it's persistent, you may need help, right? Because lack of sleep is very, very detrimental to our bodies. It's not just, feeling tired. It can really, really impact us physically in some very serious ways. So, persistent sleep issues, um, when it starts to stop you from doing the things that you enjoy,
right.
it causes you to isolate from other people.
Hmm.
You start feeling worthless, or it affects your ability to concentrate like on a regular basis, like you just can't get anything done, you
Right.
know. And then always, if you ever start thinking about harming yourself,
Yeah.
if it's something like you just feel like it's just too much, I don't want to be here, when you start getting to those type of places, and it doesn't have to be all of them, because for some people, just not being able to sleep is enough. And they're just like, I need help. Like, I need to, something is wrong. Or just,
Right.
feeling like they're isolating themselves and they don't know what to do. So it doesn't have to be all of them, it can be one. But definitely if there's ever thoughts of harming yourself.
Right. No, I agree. So like we said earlier with the cartoon about,
Mhm,
do you know if you lack of sleep does brain damage? Actually, to be
mhm,
honest with you, as much as I do research and stuff like that, I never
mhm,
knew that it does do brain damage to you, or possibly can do brain damage to you.
mhm,
That was very interesting to find. But I can tell you this because I have experienced pretty much everything we talked about today, especially sleep.
mhm,
Sleep,
mhm,
um, especially if you ever went, hopefully nobody went like ever went 5 days without sleeping like I did. But I can tell you this, you're not you. You cannot
mhm,
function nor think straight.
mhm,
And then
mhm,
definitely seek help. I'll tell you, definitely seek help when you get to that point, because maybe you're not thinking it, you can harm yourself or other people. Like, it, to me, it almost got there where, not me harming anybody, but honestly, I almost got hit by a truck. Let me tell you that.
mhm,
Like,
mhm,
personal experience, I
mhm,
was crossing the street without paying attention and
mhm,
not thinking, and the 18-wheeler almost
mm,
literally hit me.
mm,
And
mhm,
if it wasn't from somebody like literally running and moving me out the way,
mm, mhm,
I can't predict what would happen. But to be honest with you,
mm,
it does get to that point. But
mhm,
me being stubborn and me being
mhm,
wanting, to control everything,
mhm,
and it got to that point, and it just, it was scary. Like, I'm an adult, but it just got to a point. I was scared of myself, and my family was scared of me. Like,
mhm, mhm,
I felt like I couldn't be responsible to make
mhm.
myself, to keep myself safe, or anybody
Yes.
safe.
Yeah.
So yeah, sleep is a big issue.
It's a big one. It's a
Yeah,
big one.
Yes. Okay, so here is some things I came up with, healthy ways to cope with anxiety and stress. Um, just from researching and doing things, or like reviews about, you know, people, what do they recommend for anxiety and stress. So I like this. Try a wellness app, like Dr. Fraser stated earlier, meditation, mindfulness, be in the now, and stay focused on the present. I know I was having an issue with that. Always looking into the past and not looking into what's going on right now. So please stay focused on the now, and whatever happened in the past, you can't control. And whatever happens in the future, think positive. Positive things will maybe happen in the future, or will. Practice positive self-talk. This is temporary, definitely. Nothing lasts forever. Embrace positive distractions. TV, I'm not a TV person, but TV definitely. Music, yes. Or a good book. Reading does keep your mind off of things. Don't become a media junkie. Turn it off. Please turn it off, because what's going on in the media nowadays does cause us to stress and have anxieties. Connect with others through technology, call, text, use FaceTime. I love FaceTime. I do it all the time with my sisters. Take a break throughout the day. If you feel like you're getting stress and anxiety, I know I do, I have to walk away. Just walk away, get you a snack, look at the door. I don't know. Be nosy, so they say. Bother whoever is in the house with you. I do it. Do it. Just keep your mind off things that cause you anxiety and stress. Definitely get enough sleep, exercise, and like Dr. Fraser said, don't lift weight 30 pounds, 40 pounds if you don't have to exercise. Just take you a walk. Find a walking trail. That's what I used to do. It's nature, you get to breathe good air in, and just looking at nature, I would say, that walking is definitely exercise. Jogging too. You could do yoga at home, stretches, eat well. So
Yes.
definitely eat well, and definitely eat, because I know stress does make you, and anxiety, stress and anxiety takes appetite away. At least it did for me, where you have no appetite and it's very difficult to eat. Take care of your body. Please take care of your body, because if you don't take care of your body, then everything starts going down the drain. Take deep breaths, stretch, or meditate. Try to eat healthy, well-balanced meals, exercise regularly. Like I said, you don't have to go to the gym. You could just take a walk. Get plenty of sleep.
And the thing about the eating, if I could just put that in there, is if you're a stress eater, because some people eat more, you want to be mindful of what you eat.
Yes.
I get it.
Yes.
Kind of sometimes nice to have that ice cream.
Yes.
As a little stress eating, but you do want to be mindful of trying to make healthier choices. When you are eating, if you are stressed, or if you are studying or trying to meet some deadline, you want to get some things that are going to fuel your body and help you accomplish what you're doing, what you're trying to do.
Yeah.
So if you're one of those eaters,
stress eaters,
yeah.
Yes. You know what? I'm so glad you brought it up, because I'm only thinking about what I go through. So honestly, I'm not a stress eater. I get sick to my stomach. But let me tell you this. I have a friend that actually stress eat, and it's let's just say healthy. If you're trying to stay healthy, and obviously you're not being mindful of what you're consuming or what you're putting in your body, it does cause medical health issues such as diabetes, or being pre-diabetic. So
Mm-hmm.
yes, definitely watch that. Please
Yeah.
watch that. So avoid excessive alcohol and drug use. Definitely avoid that, because you're, to me, and Dr. Frazier, you can add to what I'm about to say, is your body is already, like, your brain is already tricking your body into doing things, or things are happening to your body that you have no idea how to control. And
Mm-hmm.
you don't want to add
Right.
drugs or alcohol to it, where you definitely don't have control. If you can control yourself, do you get what I mean?
Yeah.
So yes, please avoid that. Make time to unwind. I know it can be very, very, very difficult. I am guilty of that, to unwind, and just sometimes you just need me time.
Mm-hmm.
Try to do activities you enjoy. Connect with others. Definitely connect with others, people that you trust,
Mm-hmm.
about concerns and about how you're feeling. Talking it out and having a good person that listens to you, trust me, makes the situation better.
Mm-hmm.
At least you can focus and try to come up with solutions of how to deal with stress or deal with anxiety. To me,
Mm-hmm.
it's an eye opener when I talk to people, especially about what I'm going through.
Mm-hmm.
It does make me stop and think about what's going on and go from there.
Mm-hmm. Mm-hmm.
All right. So, resources. I know we talked about that earlier, about getting professional help, or when to get professional help.
Mm-hmm.
Mental illness, any type of, whether stress, anxiety, depression, or even if you just want to talk to somebody.
Mm-hmm.
These National Suicide Hotline, like I
Mm-hmm.
stated before, I've called that number. If you just need to talk, you can definitely, this is a good number to call.
Mm-hmm.
Um, there is a National Domestic Violence Hotline as well,
Mm-hmm.
National Child Abuse Hotline, National Sexual Assault Hotline as well. There's Abuse and Mental Health Services. There's the Center for Disease and Control, U.S. Department of Education. Um, and if you guys just need, if there's something that Dr. Frazier and I have not talked about, or just
Mm-hmm.
simply any questions, Dr. Frazier, would you mind giving your information out again? If somebody wants to get a hold of you.
Oh, sure. My phone number is 314-246-0165. And you can also email me at counselor, COUNSELOR, Danny, DANI, at gmail.com.
Right. All right. So this is, to me, this is a funny quote, but it's so
Mm-hmm.
true. Anxiety is like a rocking chair. It gives you something to do, but doesn't get you very far. And this
Right.
is, yes, and this is by Jody Pellicott. So um I actually, I to definitely agree with this quote, but honestly, like the merry-go-round or whatever it is, but it's just like, it's very fast.
Mm-hmm.
Um, that's how I feel like when I'm all over bouncing around, and I feel like I'm doing so much, but I'm not. You know
Mm-hmm.
what I mean? So
Mm-hmm. Mm-hmm.
this sums it up pretty much.
Yes.
Okay, so again, my name is Reman Jabar. You can contact me at 314-648-5343, or email me at rjabar@hecstl.org. It was great having you again, Dr. Frazier, and thank you so much for
Thank
all the
you for having
information.
me. Mm-hmm.